Assalamu alaikum. I hope you all guys are fine and doing great. So today it's our last session of Oral Health Awareness Virtual Dental Conference. So with very pleased and with very grateful response which you have guys have given. So I would like to invite our last guest speaker of today's evening, and he's the Professor Mohammad Wasim Ibrahim, and he's the Foundation University of College Dentistry Dean as and principal as well. So, without any delay, I would like to welcome our guest speaker, Professor Mohammad Wasim Ibrahim. Assalamu alaikum, sir. How are you?
Thank you very much, Dr. Farooq. Thank you.
Yes, sir. Sir, you can continue from here. Yes.
Thank you very much. Hello, everyone. Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. We will briefly will be discussing about the oral cancer, its etiology, risk factors, and of course the prevention, primary and secondary prevention. Very briefly. Uh, Next slide, please. The content of this presentation is we will be discussing the etiology and risk factors, the pathophysiology of these carcinogens, how they cause oral cancers, epidemiology, early signs of oral cancer, and how to prevent or how to increase awareness and among the healthcare workers as well as the patients. So let's start with the carcinogens. As we say, some are poor man's carcinogen and some are elite. So if we see in our population, the smokeless tobacco, cigarettes, or the various form of naswar and chalia, and all these are carcinogens causing oral cavity cancers, and many of the South Asian population are used to these various forms of carcinogens, and they are regularly using these as a habit. Next, please. So, if we come to the elite class again, shisha, pan, alcohol, cigar, and pipe smoking is very quite common in those, and some are habitual and as a routine or as a just for the sake of fun they keep on using, and all these carcinogens are causing various cancers of the oral cavity and should be avoided. Next slide, please. This was quite alarming that there is nicotine pouches available, and there is quite a lot of advertisement in the media that this is doesn't have smoke, doesn't have the smell of the tobacco, but you can still get the nicotine. And I was shocked to see this, that these advertisements are quite common on the social media, which should have been banned. So again, another form of these smokeless tobaccos which are used and being advertised, and they act as carcinogens. Next, next, please. So mouthwash, when used, and next, please. When we use mouthwashes containing alcohol and we use them for a very long time or as a routine, so there are many studies which indicate that long-term use of these alcohol containing based mouthwashes, cause they can also act as potential carcinogens. Next, please. So, coming to the pathophysiology, the most common things used in the South Asian population is pan and gutka and areca nut, containing areca nut in both of these. So, if we go to the south of Pakistan and if you go to the India, Bangladesh, most of the people or the population they use this gutka and pan, and which contains, of course, slaked lime and areca nut. The areca nut contains alkaloids. Previous slide, please. The areca nuts, of course, contains alkaloids, which results in damage to the endothelial cells, decreasing the vascularity of the mucosa and resulting in atrophy of the epithelial cells. Whereas Polyphenols and ericoline, which are also part of areca nuts, they result in stimulation of the fibroblasts, more collagen deposition or production, and decreased degradation, stabilized cross linkages resulting in oral submucous fibrosis, which is a pre-malignant condition and a high malignant potential. Similarly, there are certain elements like copper, which is cytotoxic to the epithelial cells. Next, please. Alcohol and tobacco, of course, they cause DNA mutagenesis, resulting in and acting as carcinogens, and which can lead to promotion and progression of carcinogenesis. There are certain other factors which may contribute to the oral cancer, like heredity factors, human papilloma virus, and immunocompromised status of the patient, of course, will can lead to increased incidence of oral cancer formation. If we come to the epidemiology, areca nut and betel nut quid is recognized as carcinogen and is still 10 to 25% of the world population, which of course is mostly the South Asian population, the subcontinent people. They are using it, and these are used because of the as a common psychoactive substance being used globally, and especially in overpopulation. And when we come to the smokeless tobacco or naswar, that is quite common in northern Pakistan, which of course all of these are carcinogens and they increase the incidence of oral cancers in general. And the subcontinent people, that is why they have very increased incidence and percentages of oral cancer because of pan, betel nut, and naswar usage. Head and neck cancers are the sixth most common cancer worldwide and most common cancer in the developing world. And if we consider South Asia, it is one of the commonest cancer of oral cavity. Whereas if we go and if we see various studies of the Western world, it is just 1 to 4% of all the cancers. In Pakistan, the most common oral cavity cancer, of course, is squamous cell carcinoma, with highest prevalence in males. There's a slight mix up. What are the alarming points when a patient or when a clinician who sees a patient should be alarmed about? These are certain pre-malignant conditions like erythroplakia, like submucous fibrosis, or like ulcerative lichen planus. These are the conditions known as pre-malignant condition, and many of them may have the changes already there in the mucosa. So whenever we see a patient with the erythropakia, submucous fibrosis, or like especially the erosive lichen planus, major erosive lichen planus, they should be followed very meticulously, and the incisional biopsy should be taken to rule out any changes already existing in the oral cavity. Similarly, if a patient is having chronic candidiasis or nodular leukoplakia or verrucous leukoplakia, again, there is a high incidence of malignant transformation in such patients, and they should be very regularly monitored, and follow up should be there. And wherever there is suspicion, the lesion should be biopsied. The suspicious areas there should be incisional biopsy to rule out any malignant change. Now, coming to the red flags of oral cancer, if we see, as mentioned earlier, if patient is having pre-malignant conditions, or if a patient is having any red white patches in the oral cavity, one should be very cautious, and the patient should be educated regarding the regular monitoring and follow up of these conditions. Similarly, if a patient is having a non-healing ulcer in the oral cavity, which despite giving the conservative management doesn't heal in 3 weeks time, or if there are loose teeth in a specific area of the oral cavity despite good oral hygiene of the other area, that should again be alarming, because there may be some pathology underneath which is resulting in loosening of these teeth. Similarly, if our extraction socket is not healing and there is some growth, it should again be an alarming thing. And above all, if there is some exophytic growth in the oral cavity, that should be examined, and patient should be reporting immediately to the doctor. And if, on the other hand, beside oral cavity, if there is any communication, sinus communication of the oral cavity to the skin, or if there is any swelling or lump in the neck, these are all the strongest point which should take the patient to the doctor, or the person who initially examines the patient should be immediately referring that patient to the concerned specialist. So what happens if we ignore, if we as a healthcare workers overlook these things, like all those pre-malignant conditions, or regular screening of the patients, or regular checkup of the oral cavity other than the area which patient is having problem with, patient may land up to the oral and maxillofacial OPDs with very advanced stages of the oral cancer, which is stage 3 and 4, which doesn't only makes the treatment difficult, but the prognosis also goes down. So, as I mentioned, being healthcare worker, being the dentist, we keep on looking into the oral cavity. So please, the message is that keep on looking other than the area which is causing or bothering the patient, so that if there is any change, that is detected very early, and patient can be diagnosed and treated at stage 1 or stage 2 of the oral cancer. So, as I have mentioned, that survival of both early and late disease, though it is improved because of the multidisciplinary approaches, because of the better treatment options that are available, but still the survival rate is better in early, if the lesion is detected early, like stage 1 or 2, as compared if oral cancer is detected as a late stage, though the prognosis is better these days, but still it is worse than early stage detection. Similarly, if a patient, if there is late detection, there is more depth of invasion, and there is extra node, the spread to the neck nodes, and that nodes, there may be extra nodal extension, which again decreases the prognosis of the 5-year survival of oral cancer patient. And early you diagnose, the lesser the stage, like stage 1 or 2, the better is the chance. It is more than 70% of the chance of 5-year survival. So when we come to the prevention, there are two types of, we divide into primary and secondary. Oral cancer prevention, primary means the portion or the things which a patient needs to do, and secondary prevention means those responsibilities which a healthcare worker or a dentist or a maxillofacial surgeon needs to fulfill. So primary are those which a patient should be doing or avoiding, so that all those carcinogens, like patient should be avoiding all those substances that are carcinogens, as we have discussed and mentioned, like tobacco, alcohol, or if there is any candidal infection or dietary habits or other risk factors should be avoided. You know, who will tell this to the patient to avoid these primary, or go for the primary? This is again our duty to educate the patient that they should be avoiding all those things which are carcinogen and lead to oral cancer. On the other hand, secondary prevention means that it is the duty of the healthcare workers to detect the potential lesions early and go for the diagnosis, so that the disease or the lesions are diagnosed in an early stage, or if they are pre-malignant, at least the patient knows that they have got some potential lesion which may have malignant transformation, so they can come for the regular follow-up. And if there is any malignant transformation, that can be detected early, and the management can be done at a very early stage with a very good prognosis. So secondary prevention is basically the responsibility of healthcare workers, including dentists, paramedical staff, or the medical doctors, all those who are related with the management of the patient and are routinely looking into the oral cavities and other healthcare problems of the patient. Next, please. So, coming to the secondary prevention, again, I will be emphasizing more on this, that regular screening of the patients by dental practitioners. Of course, we keep on seeing patient regularly, and if that is duty of all dental practitioners, that if they see any oral lesion, whether it is, and it if it is not responding to the conservative management, please do refer that patient to the maxillofacial surgeon, so that early detection, early diagnosis, and better management with good prognosis can be ensured. Similarly, there should be trained paramedical staff at district levels, at the primary healthcare center like basic health unit, at rural health centers and tehsil headquarters, who can screen these patients, or especially those who are at a higher risk, so that early detection again can be carried out, and if required, they can timely be referred to the concerned specialist. At the same time, the various dental colleges across the country, that is their duty as well to arrange various dental camps, to arrange community visits, and to go to various media programs to increase the awareness regarding the various carcinogens that the population is using, how to avoid them, and how to report about any unusual thing in your oral cavity immediately to the concerned specialist. So, educating the patient, previous slide, please. So, educating the patient and specific treatment at the right time with correct diagnosis is the key, and that I would say rest with the is, as I said, secondary prevention is wholly and solely related to the healthcare workers. So as patient is concerned with the primary prevention, that again we have to educate them through secondary prevention. So what we are doing next, yes, what we are doing at the foundation hospital, we are having quarterly free dental camps that go for 3 days, and we keep on examining all those patients. Free consultation is given and screening is carried out. Similarly, our community dentistry departments have regular community visits. They were not there for last 1 year because of the COVID, but as the community has got vaccinated and as the percentage has gone down, so last 3 4 months we have resumed all those community visits, and the various teams are going to various areas, and along with the dental checkup they also screen the oral cavity and they guide the patients. Similarly, we have various programs at the radio which are concerning regarding oral cancer health awareness, dental health awareness, and various programs are also organized. Like we have on 30th of this month, we are organizing a oral health day program, which will also of course include various small presentation related to oral cancer, its prevention. So it was just a brief overview of what oral cancer is, the carcinogens and etiology, plus how we can ask or educate the patient regarding to avoid those carcinogen, and what is the role of healthcare workers or dental educators, how they can educate the patient, how they can screen the patient, how can they can guide the patient for early diagnosis, and early the diagnosis, better will be the treatment plan and better will be the prognosis. So take home message is, please ask your patients, please keep on making an awareness programs, so that the community stops using all form of tobacco, whether it is the cigarettes or whether cigars, shisha or the chewable tobacco or naswar, whatever the form is, keep on educating them that this is a carcinogen and this is the reason that the mucosa changes and ultimately you land up with oral cancer. Similarly, in the India, Bangladesh, and of course south of Punjab, the Pakistan, we have to educate them regarding the carcinogenic and dangerous effects of pan, gutka, and chalia, because most of the population they are using it and keep on having oral cancer, but still. And of course the nicotine pouches, I have said that I have seen their ads. That is criminal. At least the authorities should take action. That how can they have open ads to promote these carcinogens? And mouthwashes, I would say, ideally should not be used very regularly, or if used, at least should not be containing alcohol in it. So, if anybody sees, the patient should also be educated that if they see any change in their oral cavity or anything abnormal in the oral mucosa or inside their mouth, they should be at least reporting to the dental surgeon or preferably to the oral and maxillofacial surgeon, so that their lesion can quickly be screened, early diagnosed, and better management can be provided to them, whatever modality of treatment is required. Thank you so much.
So thank you, sir, first for presenting this great presentation and keeps preventing and sharing your valuable time and your valuable information with us. So sir, पहले तो बहुत बहुत आपका शुक्रिया और सर इंशाल्लाह हम
Yeah.
चाहेंगे कि in future भी like foundation and you can collaborate with us in many oral health awareness project. And this was a very
Yeah.
great presentation to end the oral health awareness, because we were the main theme of this conference was oral health awareness. So your topic was about the all the awareness of carcinogens and the different things which can cause oral cancer. So sir, very very good presentation. सर एक एक सवाल जो मेरा था, मेरे से आपसे पूछना था सर, ये जो जिस तरह आपने बात की कि जो वेलो और ये जितने भी लाइक निकोटीन पैचेस हैं, पाकिस्तान में इसका लाइक एक ट्रेंड इतना नहीं है, लेकिन अब इंक्रीज हो रहा है, ठीक है। लाइक आई हैव सीन मोस्ट ऑफ द गाइज यूजिंग दिस। सो सर इसको लाइक प्रमोट भी इसी तरह किया जा रहा है। सो व्हाट आर योर कमेंट्स लाइक, व्हाट हुकूमत को क्या चाहिए करना कि लाइक इसको बैन करे, कि ये निकोटीन पेंचेस एक अल्टरनेटिव ही है लाइक कार्सिनोजन के तौर पे, जो यंग यंग लोग इस्तेमाल करने लगते हैं।
I think the Pakistan Dental Association should formally take up the case with Government of Pakistan and Health Ministry, and
यस
requesting them to ban this, and of course banning the promotion as well, because in young generation this is considered कि वो एक होता है ना कि there is a smell or there is a smoke, so this is a thing which doesn't have both of these things. So I think this should be discouraged right from the beginning, rather than once they are used to it and then we start doing it from zero again.
सर बाकी बिल्कुल बिल्कुल आपने साथ बात की सर। एक और चीज़ है कि जो आपने इस तरह बात की कि T1 T2 स्टेज में जो हम पढ़ते हैं, TNM स्टेजिंग पढ़ते हैं, सो उसमें जब पेशेंट्स आते हैं डायग्नोज हो जाते हैं तो बहुत 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 ज़्यादा चांस होता है लाइक प्रोग्नोसिस गुड होता है कि हम उसको बचा लें लाइक। लेकिन व्हेन दे आर लाइक इन एंड स्टेजेस एंड तब वो जाके डायग्नोस होते हैं, सो बड़ा मुश्किल होता है। तो सर आपको क्या लगता है कि पाकिस्तान में जो ओरल कैंसर की स्क्रीनिंग हो रही है लाइक जिस तरह होनी चाहिए, और हम जो अपनी रेगुलर ओपीडीज पे भी इसको नज़रअंदाज कर देते हैं या इसको देखते हैं कि लाइक हमें कोई लंप फील हो लिम्फ नोड्स में, और इसके अलावा लाइक हम ओरल स्क्वेमस सेल कार्सिनोमा को लाइक डायग्नोस करने पे जाएं लाइक प्लानिस को देखें, तो लाइक आई थिंक लाइक वी अवॉइड यूजली इन अवर ओपीडीज इन हॉस्पिटल्स। क्या कहते हैं सर आप?
I think एक time था when we were very few maxillofacial surgeons and people in the big cities only, but
जी
at present there are a lot of qualified people and dental surgeons with good clinics all around Pakistan, and now the things are improving.
ओके
It may take some time, but things are improving, and the good thing is that young generation they keep on referring whatever they see unusual, they prefer referring it to their teachers or seniors or colleagues who they think that can best manage those patients. So the referral is improving, but again, having said that, There are many patients who are from rural areas and don't have access to the good clinics or good healthcare workers, and they keep on reporting late. वो होता क्या है कि they keep on having medication, they keep on having various homeopathic and other modalities of treatment,
Mm.
and
Yes,
once
sir.
they are not having any response, that may take 6, 7, 8 months or a year. And
Mm.
once the lesion is in very advanced stage, and then they report to a bigger city, and they are diagnosed and managed. But of course, the late the stage is, the difficult is the treatment, and more extensive treatment is required, and prognosis of course start going down. But as far as the big cities are concerned, yes, now the healthcare workers with good clinics and good knowledge and all those awareness programs, they are referring the patient earlier as compared to the previous. So things are improving, inshallah. With another, say, 5 to 10 years, we will be having better awareness and prevention programs.
इंशाल्लाह इंशाल्लाह सर। सर विद दिस थिंग आखिर में आपका मैं एक मैसेज लेना चाहूँगा। वैसे तो आपने बातें बहुत माशाल्लाह सारी कर दी हैं, लेकिन आप यंग जनरेशन और जितनी भी, क्योंकि डेंटल कम्युनिटी भी सुन रही है और जनरल पब्लिक भी सुन रही है, सो व्हाट विल बी योर मैसेज ऑन दिस ओरल हेल्थ डे, वो आप दे दें, फिर इसके बाद एंड करते हैं इंशाल्लाह।
मैसेज एक ही है बेटा, कि बात ये है कि आई वुड लाइक टू से, whenever you are, first of all, these carcinogens should be avoided, number one.
जी।
And if you see a patient, being healthcare worker, it is our duty that don't only concentrate on the tooth. Please, whenever you see whole of the oral cavity. And even if you think that you cannot manage that, being a healthcare worker, being a dentist, those who are seeing into the oral cavity, if you see anything unusual, please refer it to your colleague for just for advice. It may not be very serious, but out of that you may find out some patient who are at a very early stage and managed just because of your proper and timely referral. So examine the oral cavity as a whole, and whenever you see anything unusual, please refer them to your colleagues. If you can manage, that is very good. And similarly, educate your patient through various programs, and if you are sitting in colleges, through various camps, community visits, to stop using all those carcinogens. Of course, they will not, everybody will not stop, but whatever you can contribute should be contributed.
बिल्कुल सर। सर ये आखिर में एक सवाल आया, ये आप इसका जवाब दे दें। हाउ अबाउट स्मोकलेस टोबैको लाइक सिगरेट एंड वेप आर मोर डेंजरस देन रेगुलर सिगरेट्स? सर इस पे ज़रा बता दें, क्या कहते हैं कि जो स्मोकलेस टोबैको होते हैं, नस्वार या वेप होते हैं, वो ज़्यादा खतरनाक होते हैं एज़ कम्पेयर टू नॉर्मल सिगरेट्स?
देखें, they are placed at a pouch or at a specific area, so
हुँ,
a concentrated effect of those chemicals are at that particular area, so there is an increased chance of that carcinogen acting on those particular areas, and early change resulting in uh, changes in the mucosa at that particular area. And plus, initially it is dysplastic changes resulting in uh, oral cancer at a later stage.
ठीक हो गया सर। सर बहुत-बहुत शुक्रिया आपके टाइम का। इंशाल्लाह
Thank
सर
you
फिर
very
आपसे
much.
मुलाकात होगी। थैंक यू सर, बहुत-बहुत शुक्रिया।
Thank
जज़ाकल्लाह,
you
खुदा
very much. Thank you very much.
वेलकम सर,
Assalamu
खुदा हाफ़िज़।